Hi, this is Thomas with Helix Sport and Spine in Ballard. Welcome back to our second installment in our 2-minute prep video for our deadlifts. Today's goals are talking about 3 different deadlift forms and what are the biomechanical differences and why you try to use each one. We're not going to get super in depth with these, but it's just kind of a precursor for the following videos that we'll show you down the line. If you haven't watched our first video in regard to hip flexion and how it limits your deadlift form, go back and watch that first, and that'll help you transition into this video. So the first form we're going to talk about today is a Romanian deadlift. In a Romanian deadlift, or sometimes called a stiff-legged or straight-legged deadlift, I don't love the straight-legged deadlift terminology, our goal is to basically target our glutes, our hamstrings, and we have a nice increased load on our lumbar spine. So our setup here, we're going to stay nice and close to the bar. As we get down to that bar, we want to make sure we're not rounding our back excessively. We pull the bar off the floor, hands are slightly outside our hips. From here, my intention is to shoot my hips straight back with soft knees. As I bring that bar down, it needs to stay nice and close to my body. And my limitation here is most likely going to be hamstring length. So in this position, I feel my hamstrings are quite lengthened, and any farther movement is going to result in lumbar flexion, a position we don't really want to be in under load. So as I sit back up properly in this position, my drive back to the top is going to be through my heels, from my glutes, and my hamstrings. Take a nice big breath in as you're coming down. Exhale to lift back to the top. One concept that might be quite important with this form is something we call intra-abdominal pressure. If you're not familiar with that, I would go back to our YouTube page and check out our intra-abdominal pressure videos, because that'll walk you through how that concept works through lifting programs. Our second deadlift form, I will move from the Romanian deadlift down into a conventional deadlift. This deadlift is going to start to place a little bit more work on our quads and our knee extensors and allow us a little bit more upright angle of our torso. So from my Romanian deadlift position, I would essentially hit the bottom. Now, my bar is probably not going to be to the floor in this position. So if I really wanted to get that bar to the floor, my next goal is to sit my hips back. You're going to watch my knees start to drift slightly forward. This is going to be a little different than what it would look like if I had load on the bar, because I can't lean back quite as far as I would normally. But from this position, you can see knees go forward slightly, and my trunk angle went from more horizontal to more vertical. Now, the demands of that exercise are going to decrease the load on the lumbar spine, and again, increase the load on your quads. So now we're basically sharing work around the knee and the hip, so a little bit less of a moment arm to the hip and more to the knee. So you're going to share again between your glutes, hamstrings, and quads a bit more. So going through just a couple reps there, what I want you to notice is the bar path, okay? And that's actually going to be a video that we go through down the line. But as I sit, for me personally, you'll notice my knees are so far forward that that bar kind of starts to run into my knees. So this might not be the most appropriate form for my body personally, okay? So going through a couple more reps there, push to the top, pushing through the feet, engaging glutes, quads, and hammies, sitting back to the bottom, okay? Now, what if I wanted to shorten the range of my deadlift? We'd move into what we call a sumo deadlift. Now my hands are going to be inside my legs rather than outside, and my stance is going to be quite a bit wider. With a sumo deadlift, again, we're going to increase our demand placed on the quads, specifically vastus lateralis and medialis, and I'm also going to be allowed a little bit more of that upright angle of my torso. So my feet go nice and wide. Most people are going to have a slight external rotation position of their hips. As I sit to the bottom of this deadlift, I'm going to use the bar to sit back into that position. Again, my torso angle is a little bit more upright. You can see I'm pulling scaps down and back. From here, I push away from the floor, stand tall, and then return back to my lowest position, letting that bar touch the floor. This is going to be a shortened range of motion for your deadlift. Sometimes people are able to pull a little bit more weight, but again, that's most likely because we have our thighs working with our hips in this position. If you can do this exercise correctly, the sumo might be the easiest for someone with a history of low back pain or low back injuries, just because again, my torso angle isn't quite as horizontal and it's allowed to be a little bit more vertical. Intra-abdominal pressure is important with all of these exercises. So again, try to go back and watch that video. And then that sumo deadlift might be a good option for you if you tend to have pinchy hips as you lift the knee up in front, because that position of external rotation maybe allows you to get a little bit deeper into that lowest position of the deadlift.